Hello and welcome everyone. My name is Dr. Manickam, and today we're going to talk about feeding when babies are 4 to 6 months of age, or i.e. when babies are starting to eat solid foods or puree foods for the first time. So when we say puree foods, we're talking about foods that are applesauce consistency. And if you remember from our prior video, the 4 criteria I think about before a baby's ready to start eating puree foods is first, that they can bring their hands midline. Second, that they actually are able to reach out and grab foods. Third is that they can actually control their head, so when you pick them up, they're not leaning their head back. And then fourth, they're actually interested in the foods you're eating at the table. When they do hit those criteria, we can start thinking about them eating those puree foods. The reason why we want puree foods, applesauce consistency, is because they don't have to chew that sort of food. Good first foods to give in puree form are things like bananas or fruit or spinach, other like sort of vegetables that are blended to that consistency. The key is when you do introduce those foods for the first time, you should give at least 2 days between introducing a new food. The reason why is you want to monitor to see if they're allergic to any of those foods. The signs of an allergic reaction for you to monitor for during those 2 days in between a new food is first if there's any skin rash, swelling anywhere, swelling around the lips. Second, if they have any gastrointestinal symptoms, that means vomiting or diarrhea. Third is if they faint, which is very rare, or they have change in color of their skin. And the last thing, in worst case scenarios, they're having difficulty breathing. If you see any of the symptoms, particularly 2 or more of those symptoms that I talked about after eating or trying a new food, you should go to the emergency department, or at the very least, call your pediatrician so they can tell you what dose of Benadryl to give. That way we can try to reduce that infection, but you probably still have to go to the emergency department because you're going to need something called epinephrine. That's what an EpiPen is, to help treat that allergy symptom. But of course, most of the time, there's no allergic reaction. You just have to make sure that you spread it out between 2 days. That way, you can properly make sure they don't have any allergy symptoms. Another key thing for you to do is to make sure that you introduce peanuts as early as possible. This does not apply for kids that have severe eczema, those are the severe skin rashes, or have other allergies. In that case, you should only introduce peanuts in a monitored setting with a doctor or whatever your pediatrician recommends. But otherwise, for most kids, you want to introduce something peanut related, like peanut butter, early on, around that maybe 4 to 5 month mark after you start eating solid foods, after you've tried a few new ones. You want to mix a little bit of peanut butter into a puree food that you know they're not allergic to. The reason why we do this is the earlier you introduce something peanut related, the lower chance your baby has of developing a peanut allergy. The last thing I wanted to mention in this section is water. You should only really give your baby free water to drink after 6 months of age. You shouldn't be giving it beforehand. Beforehand, the breast milk or the formula you're giving is plenty. With that, here are a few notes for you to keep in mind as you listen to our videos. First, all the information that I share is my own clinical opinion and not reflective of any of the other institutions I was a part of before or are currently. Second is that all the information we share is for full-term babies who are born greater than 37 weeks and have no other medical abnormalities or medical issues. So make sure you talk to your pediatrician before implementing any of the tips that we talk about to make sure that they're tailored for your child. And lastly, for any medical professionals in the audience, if you have any other clarifications or advice you want us to include in our videos, please send us a direct message, email us. We're happy to include them as well. And if you like what we're doing, please click the like and subscribe button below. That way you can stay tuned with all the information that we share for parents. Thanks for listening. Take care.